For our final fireside chat of the day before our closing keynote, I'd like to introduce Tara Hogan Charles of Procter & Gamble and Dane Smith of FSG. Tara Hogan Charles is Senior Director of Racial Equity Programs and Partnerships with Procter & Gamble, where she is helping to embed a racial equity strategy across the company. Based in Washington, D.C., Tara has been with P&G for more than 20 years and most recently worked in government relations and public policy. Dane Smith is a Managing Director in the Washington office of FSG, as well as a close personal mentor of mine. Dane leads FSG's corporate practice in the United States and Latin America and has over 25 years of experience advising private and public sector leaders on business strategy. He has particular expertise in helping companies develop purpose-led strategies that increase profitability and social impact. Dane has worked with numerous pharmaceutical companies, providers, and insurance companies on their equity strategies. Dane, I'll pass it to you.
Thanks so much, Nikhil. Good morning to everybody. I'm really delighted to be here with you all this morning and to have the opportunity to talk with Tara Hogan Charles from Procter & Gamble about health equity and the shared value opportunities that companies have to advance health equity in a way that increases their competitiveness and profitability. Now, one of the things that I've learned over the course of the last decade, working with companies to develop their shared value strategies, is that the company leaders who succeed must have conviction in and passion for the ideas that they're working on. Without that conviction and passion, they can't hope to persuade their others, their colleagues, their partners to be bold in advancing shared value. As you are about to hear, Tara Hogan Charles has that conviction and passion in abundance. I've known Tara for about 6 years, and I've really enjoyed watching her working with her colleagues and partners to find innovative ways to create social impact through the business. And I'm so happy that you all will be able to hear about some of P&G's wonderful examples today. We are going to focus a lot of our discussion over the next 20 minutes or so on gender equity in health. In most places around the world, women's health, particularly sexual, reproductive, and mental health, continues to be deeply stigmatized and considered taboo. And as a result of this, women and girls not only face discrimination and exclusion, but actually severe mental and physical health risks. Disparities are even more acute for marginalized groups among those who identify as women and girls. In addition to this, according to some estimates, gender-based discrimination costs the global economy some $12 trillion and greatly limits opportunities for women and girls to meet their full potential. Tara, P&G's products reach more than 5 billion consumers each year. You and I have talked about this many times. I would love for you to share a little bit with our audience about how you think about the role of such an influential and powerful company to advance social change. And more specifically in that, what can companies like P&G do to help defeat gender-based discrimination around the world, particularly as it relates to women's health?
Well, thanks so much for that introduction, Dane, and for teeing up this conversation. I am absolutely thrilled to be here with you. Almost 6 years to the week, Dane, that you flew to Cincinnati to help P&G on our purpose-driven strategy. So I actually looked back at my notes, and it was November of 2015 that we had our sessions here in Cincinnati. So I feel like this is a full circle conversation. So thank you so much for having me and inviting me to this conversation. I think it might be helpful to share a little bit about a quick overview of P&G. We are a 184-year-old consumer goods company headquartered here in the US in Cincinnati, Ohio. Our products are sold in more than 180 countries, and we have on-the-ground operations in 70 countries with about 99,000 employees. If you're not familiar with P&G, then I'm hoping you're familiar with many of our brands like Tide and Ariel and Pampers and Crest and Oral-B and Charmin. So you talk about equity and you think about, what role does a company like P&G have? Just the sheer scope and breadth and depth of our organization means that we have not only a responsibility, but an obligation to make sure that we're engaging in how we serve consumers and how we serve our communities with the lens towards equity. Equity or equality and inclusion is really fundamental to us. I've been at P&G for 20 years. And as a, from a personal perspective, we live our values. And that's part of the reason why I've been able to be a lawyer, a lobbyist, and now in this race equity space, because I truly believe that we are coming from the space of living our values. Our aspiration is to have a world, Dane, where people can truly be it's better for everyone, regardless of their race, their ethnicity, their culture, their sexual orientation, religion, gender identity or disability or their background. That's our aspiration. But we know that there are systemic barriers and systemic structures that keep certain communities from reaching that aspiration. That's why we have to be both strategic and intentional about creating and acting in a sustained way. So for us, it's about building it into our business and not bolting it on. And so as we talk a little bit about how that comes to life, I think it all starts from that foundation. During the pandemic, many consumers rely and still rely on our products in order to maintain their hygiene and health practices, in order to help keep their homes and their families safe. In that work, not only are we making products that consumers need, but we also donated a lot. And we saw firsthand the inequitable impact of COVID. I don't know if you recall, when we first realized that there was a pandemic, there was all this conversation about it's going to impact everybody. This is going to be everyone's going to be impacted by COVID. But as we saw, as the death toll started coming in, we realized that it was not hitting everybody the same, that Brown and Black communities were disproportionately impacting and they were disproportionately dying. So what COVID did is it really did display for all of us the pre-existing health inequities in our system. And I think a part of our work today and for everyone who's on this journey to take the sustained and systemic action in order to tackle those barriers.
That's great, Tara. And I hear you sharing with the audience, and I've heard it from you many times, that one of the critical things to which you attribute your success is the authenticity that P&G has as you think about tackling these programs, both in your philanthropy and how you think about doing it in your core business as well. I wonder if you could share a little bit about some of the specific programs that you're particularly proud of, ways that P&G has been able to tackle issues related to health equity.
Sure. So I think authenticity is important, especially when you're dealing in areas of gender and race, because I think there is, it's really important that, I've seen many of our programs that do really, really good work, but because it's not core to our business, whenever there's a change in the business circumstances, those are oftentimes the first programs that get shut down, unfortunately. Delivering great work, but if it's not necessarily the way that the company goes to market or serves its consumers, then it's ultimately not going to survive. So I'll talk a couple of examples. You highlighted, women and girls, and I'll talk a little bit about the menstrual equity issues or challenges that we have. So our Always brand has been doing puberty education around the world for over 35 years. It's core to to who they are. They've taken the opportunity to educate women and girls about what's happening with their bodies, about their periods. But we're doing this work outside the US, and then we realized that 1 in 5 girls in the US don't have access to period products. So there is menstrual inequities here in our backyard. And we're finding that COVID has only exacerbated that. So you have a brand whose goal is to focus on the drop in girls' confidence at puberty. They have this recognition that there is a lack of access to some of their products, right? So they undertake that as one of their solves. How do we defeat period poverty? And so this has been a years-long campaign for the brand. In addition to donating a lot of products, they appreciate that they have to take systemic and sustained action, both from a public policy standpoint, both from raising awareness that this is an issue. And so we've partnered with retailers, we've partnered with organizations like WASH, like Plan, in order to bring a lot of these priorities and all of these actions to life. So while the brand has donated 30 million products, we appreciate that there is much more that can be done and much more that they are doing. And they have built on year on year on year. Yeah, I attribute always the Like a Girl campaign with all of us rethinking when we say you do something like a girl, that used to be like a bad thing. Now it's an empowering statement. You know, that's what the power of brand can do. It can change culture and societal norms in a positive way, in addition to addressing some of these inequities in the system.
I love that example. And one of the things I hear you saying, Tara, is that it's really critical that you find ways to align different parts of what FSG likes to call the purpose portfolio of a company to advance the impact that you're having. So you have your charitable contributions and you have your business and they work in a sense hand in hand to try to create that equitable change. And I like the way that it sounds like maybe a term that P&G uses, the solve for the brand, to really look at how you can tackle that issue of the potential risk of diminishing of confidence for adolescent girls at that time. One of the things that we've talked about a little bit, Tara, is that it's not hard for P&G to consider issues of health equity to be core to the business, because if you, as large as you are and as much as the world is changing right now, if you don't think of those issues as being a business challenge for you, a business problem, then you're not going to maximize your growth in the future. And so I know that you don't see there as being much of a trade-off there, because your growth and your success is very much aligned with what you're trying to do around health equity. Can you say a little bit more about that?
Sure. I think any consumer-facing company, Dane, I mean, I don't know if you've seen the latest census data, but our crunching the numbers demonstrate that the fastest for the last 10 years, the fastest growing markets and demographics have been multicultural consumers. In fact, our chief marketing officer just 2 weeks ago said that it's no longer multicultural marketing, it's just marketing, because the nature of who we're serving today. And if we've been around for a really long time, 184 years, as I mentioned earlier, if we don't maintain a close connection with our consumers, if we don't understand what their needs are, what their challenges are, how is P&G showing up in their day-to-day life? That's absolutely critical for us to be around for another 180 years. We've learned the very hard way that once you get disconnected from your consumers, once you can no longer speak to the issues that they care about, once you can no longer develop the products that they need to meet their needs, then you're really going to find yourself out of business. It's a pretty competitive market out here, and competitors are popping up all the time. And if you're not paying attention to what your consumers want and need, someone else will. And it's pretty, there's the possibility that you run the risk that they'll come and serve those consumers better, and consumers will make a different choice. So I think that that's the case for any consumer-facing company. And I think if I think about our supply chain, right? So the number escapes me, but the number of suppliers that we have in our supply chain, if it's a priority for P&G. So that's how I think there is a ripple. I think, it's not just limited. This is of the business these days.
Thanks for that, Tara. One of the things that's particularly notable about what P&G does is that you've been, I would say, innovative and even in some senses, some might say, willing to take some significant risks in the way that you use advertising and communications to challenge harmful stereotypes and to change the narrative. I know that this is something that for many consumer products companies, it's kind of anathema, the notion that you would depart from what's been tried and true, that's worked for you to move your products, to create bonds with consumers in traditional ways to drive usage. Tell me a little bit about that and how you think about your advertising strategy as a way that it complements and strengthens and furthers your shared value strategy.
Sure. So it's interesting. being a part of a big marketing company, especially now in this current role, I get to see much more of the sausage making and how we think about developing and creating advertising. As a lawyer, I would just look at the claims and make sure we could support the science, right? But being on this side, there are some structural and very public commitments that we have made about how we're going to approach our advertising. Advertising can perpetuate stereotypes. Advertising can perpetuate harmful images and notions of people. Advertising can, reinforce negative stereotypes. So one of our kind of guiding lights is we will accurately portray human beings in their vastness, right? One of the campaigns I'm really excited about is our Widen the Screen platform. And if you think about advertising and images of Black people, they're either struggling or there's this image of triumph. And so this entire platform is focused on how do we make sure that the talent behind the camera, in front of the camera, those who are working on set, are in a position to tell those authentic stories that can just demonstrate the vastness of Black life. And so one of the areas that we've tackled with this Widen the Screen platform is Black maternal health. The Queen Collective is one of our signature programs, and it focuses on women of color directors. And so it provides mentorship, production costs in order to tell the stories that they care about. And one of our directors this year created a documentary called Black Birth, and it follows the 3 pregnant Black women and their experiences, the joys and the challenges and the triumphs of being a Black pregnant woman in this country. And as we know, as we've seen some of the celebrities, including Serena Williams, talk about the harrowing experience of giving birth as a Black woman in this country. You're not, when you think about the stats that Black women are 2.5 to 3 times more likely to die from pregnancy-related causes than white or Hispanic women, that disparity persists across education, and I think with Serena Williams and some other famous celebrities, and also income. So it's one of those issues that you look at the intersection of gender and race, and that's where you have the disparity. So in addition to raising and elevating these stories of Black women, these stories need to be told. The Queen Collective is delivering on that opportunity. We also have our Pampers brand, which has launched a menstrual equity platform whereby they've co-created with the March of Dimes and with several noteworthy experts, professionally accredited materials that talk about anti-racism in the maternal child health arena, so that they can then educate and provide additional actions that hopefully will address some of these systemic issues in Black maternal health. So that's, Dane, it's one of those examples of where we've got this corporate platform and voice, but also our brand showing up to also demonstrate how they can view these issues from an equity standpoint.
Thanks so much for that, Tara. I love those stories. For those people in the audience that are a little bit less familiar with shared value, I suspect when they hear these powerful stories about the way that you're using your advertising, it may occur to them, well, that sounds great, but that really doesn't really sound like the business. That sounds like just something that P&G is doing because they care about this issue. They want to get good PR associated with being on the right side with health equity issues. Can you explain a little bit more how this is actually a business decision for P&G to focus your advertising messages in that way?
Right. I mentioned earlier that we see this work as a force for good and a force for growth. We talk within our company about how consumers expect more from companies. They expect to understand where companies' values are. So we don't see this as distinct. We don't see this as a nice to have. We see these as issues, these issues of equity, as those our employees care about, our consumers care about them, our investors care about them, so we should care about them. This is a business issue. In addition to the changing demographics, which I think anyone can look at those numbers themselves, again, staying close and understanding our consumers, but also our employees and our shareholders who increasingly want to know where P&G stands on these issues. We try to find those places, Dane, where we can provide some perspective that is based on an expertise. So the examples that I'm giving are based on places and spaces that P&G knows a little bit about. We know a little bit about diapers and moms. We know a little bit about puberty and education. We know a little bit about, the drop in girls' confidence, right? So these are areas that P&G has a unique, I would say, perspective and a role in society that we can then leverage to authentically engage and authentically partner and authentically deliver really impactful and sustained action. I'll share one other example because I think it gets at some of the societal norms that can be perpetuated by advertising and how changing the dynamic is a growth and good. So back in 2015, a lot of good stuff started in 2015. I met you, we were doing this great work with Always. So we had this campaign called Share the Load in India. And oftentimes these campaigns are based on insights, or we call them outrageous facts, that we learn by working in this space and pushing ourselves to have any increasingly more impact. And so we found that back in 2015, 70% of men in India felt like the household chores were a woman's duty, and the 1 in every 3 women felt like it was their responsibility as well. So you had this perception that the household duties, whether there was work outside of the house or not, but it was the woman's work to do. So we created this campaign called Share the Load, and over the last, I think they're in the 4th campaign, where they really questioned, is it really a woman's, just the mom's job to wash the clothes? And so we model men washing clothes in India, right? And over several years, we've been able to show that more and more men, not all of them, we hadn't gotten there yet, but more men feel like it's a part of their responsibility, right? So if there's more shared household duties, household chores, that frees up, that provides, the data is clear, health benefits, all sorts of benefits to the overall family. So even in our marketing and as an advertiser, we model, right? Men washing dishes, men washing clothes, women doing anything that they want to do, right? So there is this responsibility, but it also helps us when we demonstrate him washing clothes is using Ariel. So there's that. So that's how I think that's how we bring these all together, Dane, as not just things that we like to do. We wouldn't be doing this if it didn't build our business. We've been doing it year after year after year.
I love that Share the Load story, Tara. And it is very clear to me how something as simple, but also well thought out as that can really influence the way that thousands, even millions of people think about gender stereotypes and gender roles, and how it can create a deeper emotional bond with your customers and consumers. So thank you so much for all of these great stories, Tara. Really enjoyed talking with you again, as always. And glad that everybody else had a chance to hear about some of the wonderful P&G examples.